I'm drifting back to you.
Memories are the very fabric of life. They are the sum total of who we are, where we've been, and where we're going. I'm Sharon Arkin, a therapist specializing in Alzheimer's disease. This program will demonstrate therapeutic techniques for Alzheimer's patients using a camcorder and a VCR. The woman you've just seen is my mother, Bee, diagnosed with Alzheimer's 3.5 years ago. Bee and other memory-impaired people will be helping me show how video can compensate for memory loss problems. Memories bind us to our past, provide meaning to our present, and give shape and direction to our future. When memories vanish from Alzheimer's or other causes, confusion, anxiety, and depression often ensue. Outgoing individuals may retreat into a shell, no longer sure of their identity, capabilities, and self-worth. Thanks to the miracle of modern video technology, friends and family members can create videos that serve important therapeutic functions for their loved ones with memory loss problems. These videos can record thoughts and feelings, encourage, inform, reminisce, reassure, and entertain. These videos can be played and discussed with the patient by hired caregivers when family or friends are absent. During this program, I will share with you examples of videotapes that perform the various functions mentioned previously. Alzheimer's progressively robs its victims of their ability to express themselves. Thoughts and emotions may be present, but familiar words cannot be found to voice them. Some early-stage patients can foresee this condition affecting them. Dick was such a patient. Dick used video to express feelings about his life, family, and affliction while still able to do so. Two methods were used with Dick. The first was a sentence completion exercise.
Before I started having problems, I thought that Alzheimer's
was for old people.
Mm-hmm. Since I've had Alzheimer's, I feel angry that
it had to be me.
Okay.
I'll repeat that again, Sharon.
Since I've had Alzheimer's, I especially appreciate
the support that I've got from Carol.
Since I've had Alzheimer's, I miss
work, my work, being able to work on vehicles and change them around the way I wanted them.
Mm-hmm. Since I've had Alzheimer's, I've learned to enjoy
my family and my friends have become much more precious than they were before.
Since I've had Alzheimer's, my wife
my wife and I have basically and in many ways reversed roles.
Okay. Since I've had Alzheimer's, my son Jim
well, I guess what comes to mind immediately is he's kind of, in a way, become the man of the house.
Okay. Since I've had Alzheimer's, I feel embarrassed when
I can't, in conversing with somebody, I do get embarrassed when, it goes, the mind just quits. And that's one of the reasons why early I just got it out to the neighbors and everybody else, so they know what. I'm not a dummy. I just can't grab the words sometimes.
When I tell someone a story for the second or third time, I prefer that they...
Tell me you've already said it.
Okay. Won't hurt your feelings?
Not at all.
Okay.
Dick was also videotaped speaking one-to-one with family members. He later described the cathartic effect of these dialogues.
After the videotaping session with Jim, Clark, and Jeff, I felt...
Up. Really up. Because I got things, somehow it got out from my head and got into all the rest of us. And...
I mean, things that you wanted to say.
Wanted to say, and yeah, I guess that's... once I had said it, it was kind of peaceful. You know, and I had a lot more insight in me and the people that I were talking to.
Mm-hmm.
If that makes any sense.
You have just seen video being used to help an Alzheimer patient express and record his feelings. After a brief detour, I will show you several videotapes that have encouragement as their main purpose. In a previous program, I demonstrated how an audio cassette recorder can be used to help Alzheimer patients remember things. A scene from that show will illustrate.
Question 1. There were 5 important events in your life that happened on February 15th. Let's see if you can name 3 or more of those events.
We met on February 15th. We were married on February 15th. Nancy was born on February 15th. My diploma was, oh, wait a minute.
Right, good.
Was on February, marked on February 15th.
Correct answer is any 3
You got
of the
4,
following.
so don't worry. You got 4 of them.
You met your husband, give.
Diploma,
You graduated
mortgage.
from college.
Mortgage, you got the 5th one.
College.
Good.
February 15th.
Mellon, the woman you just saw, is one of those individuals who gets depressed about her declining abilities. However, whenever she sees herself answering questions correctly on a videotape, she gets motivated and encouraged. In the following video clip, Mellon describes her feelings about memory therapy before and after watching herself on a tape doing a good job.
I just thought it's a waste of time and energy on your part, and I knew it wouldn't do one bit of good. But today, after seeing this, I feel it could help.
Watching oneself perform successfully on video or audio tape builds self-esteem and is an activity that can be shared with relatives, friends, and support group members. Another encouraging type of video is one that shows the memory-impaired person doing something she or he is good at or proud of. B is very proud of her musical ability and that she sang with the Chicago Symphony Chorus for many years. During a recent trip to Boston, Bee visited the home of Boston Philharmonic Orchestra conductor Ben Zander. One morning, she helped him rehearse for a piano recital. She was so inspired that she sat down at the piano and played a piece she hadn't played in 20 years. Showing Bee the videotape of her and Ben is guaranteed to put her in a good mood. An interesting follow-up to that story is that Bee is taking piano lessons again for the first time in more than 60 years.